Welcome to the Healers Café, conversations on health and healing with Manon Bolliger, a retired and deregistered naturopathic physician with 30 plus years of experience. Here you will discover engaging and informative conversations between experienced healers, covering all aspects of healing, the personal journey, the journey of the practitioner, and the amazing possibilities for our own body and spirit.
So welcome to the Healers Café. And today I have with me Lynn Anderson. She's a naturopathic doctor. She's a yoga and nutritional therapist. She's a fitness professional, karma master, published author, international speaker, and video producer with over 30 years of experience in the field of natural health and fitness. And I'm not going to go through all the places you've talked. That'll all be on the website. But I just want to welcome you and ask you two questions.
Okay.
To start with. So what in the first place attracted you to the field of naturopathic medicine, or was that the place you started? How did your journey begin?
Well, if I give you two levels to that. First, I grew up on a small island off the coast of Maine, and it was a little fishing village. And there was about maybe 500 people on the island. And of course, we were all related. And it was, and we're going back many years. We had one telephone on the island. It was very, very rural. And there were no doctors. And so I grew up around a lot of people who practice folk medicine, or we used to call it kitchen sink surgery, where there were things that people could do. You could get things and, like burdock, and use that and make a poultice with it, and, to draw poison out if you had to. And we always everybody had a root cellar, and in the root cellar would be like elderberry wine and, things that were put up, and, just little tonics and tinctures. So I kind of grew up not running to the doctor and getting medicine, but, kind of in that natural environment. But then if we fast forward a little bit, I was a single mother with two children, and I decided to go back to the university and finish my undergraduate degree. And so I did that, and I had no money. I mean, I was broke. I was on welfare. I was taking loans, grants, anything I could to get myself through school, because I felt that was really important. And through that whole process, at the end, I really had a total collapse of my physical, mental, and soulful self. It was pure exhaustion from everything. And, I had two kids to support. I had to get up. I didn't have time to lay around in bed and feel bad for myself. So I had taken, when I was in college, I had taken a fitness and health class, which was really an eye-opener to me. And it was a lot about fitness and nutrition and stuff like that. And so I kind of gravitated to that. And then using my background growing up, I began to realize that, everything we need is right there in nature. We just look for it. It's all right there. And to me, that was a better road to take than antidepressants or, whatever the prescriptions were. And so that's what got me on to the path of where I've ended up.
Interesting. Yeah. It's funny how, I think now, looking at what's happening in general, I think there's really a comeback to this. People are asking, how do we take care of ourselves? How do you do basic stuff that was natural and known, had lots of names for, I can't remember all the ones I've heard, but it always has a name as if somehow it didn't work, and now, people are looking for it because, at least here in Canada, our system is broken. We call it healthcare, but it's really pharmacare. And on top of that, it's, a lot of people left. A lot of doctors and nurses left because of the mandates. And then a lot of people who continued because of the stress, the lack of, resources, and because of the mandates, by the time they're the third or fourth, they're either not there or really, have immune compromise and are getting sick. And so we're in a major crisis. So yeah, it's an interesting thing that you came from there. Then you became a naturopathic doctor, right?
Mm-hmm. Yes. And but then I'm a part of the American Council on Exercise, which is a fitness organization.
Okay.
It's an international organization, and I've been certified for over 32 years with them. I'm one of their old people from began at the very beginning of that. And
Yeah.
that was really incorporating the exercise part to it. From there, I went on to become a certified yoga therapist, so that I combine all of those things together in my teaching. But I might mention to you, you're talking about this, when I first started in naturopathy, I wanted to create some kind of an herbal mixture for stress. And so I started to look for an herbalist to teach me, to train underneath a certified herbalist. And it's very hard to find. And I found this one woman, and she only agreed to work with me if it was just under the radar. And it was just because at that time, if you were making herbal tinctures and things, you were considered a bit of a quack. And so she wanted to be really under the radar. And I can remember being under the radar. And at that time, being told, this is what I think is so great, is there was this herb called stevia. Now, we could not mention that was put in anything because that was not approved. Now you can buy it in the grocery store.
Yeah. Wow.
A case in point is that, so many things, it just depends upon where you are and how those things open up.
Yeah, I didn't know that story.
Yeah.
That's interesting. So then where do you live now, or what's happened since?
Well, I moved to Los Angeles, and I spent over 25 years living in Los Angeles. And then just before the pandemic, my husband and I bought a house in Sarasota, Florida. We decided we were going to move to Florida and leave Los Angeles. I have to admit that my daughter moved here and brought my grandchildren, so that was a big draw to get me to Florida. So, so we left. We actually moved 4 months into the pandemic. We moved completely across country here to Sarasota, Florida. I'm very happy to be here.
So, but that's a lot, leaving your whole, practice, and and from Canada. I mean, we hear about California a certain way. We hear that there's all these restrictions, and it's much harder, and I think it's different for naturopaths than it is in Canada. I think there's more freedom, but there's still just to be with people that are more in fear is a very different experience. I have friends in Florida, and it's like it's like as if it doesn't exist, this whole thing, this whole...
Well, California is it's very liberal, and it's very anything goes, and that's kind of the beauty of California. And the other part of California is it's a melting pot, and it's so much diversity, and it's just that's the beauty of it. And I had such beautiful people that I, by the way, am still connected with, because I do a Zoom class and they're all connected with me on Zoom.
Oh, great.
But when California also has it's a very, especially in the Los Angeles area, it's a very pretentious area. And it's a very conspicuous consumption, and a lot of money, and you have the haves and the have-nots. And there, and it's there's not an awful lot in between. And it became just a tremendously expensive place to live to begin with. And now, as I understand from my friends there, Los Angeles and San Francisco happen to be the biggest homeless places in the country.
Yeah.
Crime is out of control there. Housing is out of control. It's a very difficult place for people to live. And that's why everyone is leaving for places like Florida or Texas, or places where even young people, where they can afford to have a home.
Right, right.
Yeah.
Yeah. Yeah, I guess a little bit I've been following the economy of those places too. It seems like everything's being bought up, and then you're sort of stuck with rent, and then, and it's changed from the small mom and pop shops that may have had a few renters who now can't afford their mortgages, right? And then they're being bought by bigger corporations, and then there's no ceiling to the rent, that first it looks good and then it goes up, right? So it seems very very hard to really make a living and to know that you can own a house, eventually, right?
Yeah, you have to really be on the upper strata of,
Yeah.
Hollywood, in the Hollywood thing. And then you have these mega mansions, and, and then you have people living on the street. It's a very, very difficult. And I think when you reach a point for a lot of people, especially retirement, it is not senior friendly. So
Right.
people leave, they go there, they're hoping to make their money. But, and there is a lot of opportunity, always was a lot of opportunity in Los Angeles. And I'll always be very grateful that I lived there. But it's so much calmer here in Sarasota, Florida.
Yeah. So you're at this moment, you're not running an actual practice, but you're teaching. That is your main.
Yes, what I'm doing is I have online Zoom classes that I teach, and I'm also connected with Sarasota Memorial Hospital, is one of the top hospitals in the country, by the way. And I teach classes there, and I'm also on the lecture circuit there. So I lecture on health and fitness for them as well. So that's been a really good connection there.
Yeah.
Because
that's getting it, in vital information to a lot of people.
And they're a wonderful hospital because they have created it's called Health Fit, and it's a gym, and you can go there for physical therapy, but you can also go there as a gym, and they have regular gym classes, swimming classes, all kinds of different classes. And it's very much geared towards, I would say, people 55 and older. So it's a wonderful place for especially seniors to go and get a lot of really senior classes. And so the hospital, their belief is, we promote nutrition and we promote exercise. And I can't think of anything better to promote than those two things.
No, it's perfect.
Yeah.
Sounds better than I thought.
Yeah.
So, and then you do yoga. So do you do yoga then on Zoom, and then in that case?
I do. I have two classes that I do. I do one on Wednesday and one on Saturday. Now, as a certified yoga therapist, I do yoga therapy here and there. Occasionally, I will work with someone, and that's kind of what with Sarasota Memorial Hospital. I come in and I do some therapeutic lectures and a little bit of work. I do some chair yoga and therapeutic yoga there. So that's kind of what I do. I will work with individuals. It's a little hard to do the therapy part over Zoom because, it's much better to be with the person so you can really help them adjust, because usually people who are seeking out yoga therapy have, it could be a back issue, or, they're recovering from cancer, something like that. And so it's really good to have that personal connection.
Yeah. I mean, it's hard. I run a college called Bowen College, and we've been trying to do this on Zoom. So in some ways it's fantastic because you can see what's happening very clearly, but touch is touch, and it's very hard. Like and I mean, yoga is not, it's not like a therapist relationship, but you still can see when you touch a body really what's going on, right? You can see even more with your hands. Maybe that's a total bias, but I feel like you can connect better, and you can subtly move people in ways that they would not understand if you told them,
You can, however, touching has become a real issue in all fields, and we have to be extremely careful. You must always ask someone and then be very careful, because lawsuits, all kinds of things have happened, and especially in the field of yoga and yoga therapy. There's been a lot of sexual harassment things and stuff like that have come up. So when we get, I just had to get recertified. I have to get recertified every 3 years, and we have to take ethics courses and things like that every 3 years to remind us that you have to, you're dealing with an individual, and it's how you approach that individual. I mean, and I personally I try not to do hands-on. I try to visualize and talk the person through. However, you do sometimes you'll say, can I? And they'll say yes, and then you can.
Right. Interesting. Yeah. I wouldn't have, thought of the legal component, because I guess in Canada, until the pandemic, we were less litigious. You would never think, oh, I'm going to get in legal problems, because it just wasn't the cultural way of dealing with things. But yeah, so that's quite something. So yoga teachers getting in trouble.
Yeah. Well, there was a big lawsuit, Bikram yoga, which is yeah. And that's kind of how it all kind of snowballed from there. And then, it became a big thing, especially for the certified yoga therapists, because we're held to a higher standard than just a yoga teacher. We have to go through all kinds of classes and things in order to get that certification. So when you're a certified yoga therapist, like I said, you're dealing with a lot of times with people with that have cancer, have heart disease, have different problems. So when you're working with them, and someone is coming in with physical problems, there's always the mental that comes with that. So, they're very, very fragile at that point. So you have to be really careful what you do.
Manon Bolliger here, and I want to thank you for taking actionable steps towards engaging your healing journey and helping others discover their path by watching, sharing, subscribing, and reviewing these podcasts. Every review and share helps spread the word, these different perspectives and choices and options for healing. And to thank you, I'd like to invite you to sign up to my free 7-sequence email tips on health and healing for everyday life. You can go to healerscafe.com tips. Thanks so much. What was what happened with Bikram? I heard about it, but I don't actually.
There was actually a lawsuit, and he actually had to leave the country, and he went and set up practice somewhere else, but he had quite a lawsuit against him for really, really very abusive behavior. And it was very, for people who really practice yoga and we really are dedicated to it. It was really a terrible thing to have happen. So most of us have distanced ourselves and have nothing to do with Bikram at all.
Wow, that's it's interesting. I mean, again, you think in therapy and things that are good, it's interesting how
well, it all comes it all comes down to one thing. It all comes down to money. And he was very much connected in the whole Hollywood thing, and he made a lot of money driving Rolls Royces. I mean, it's like I teach my students, it's really good to be wealthy. It's good to live in a wealthy society, because you have better education, you have better medicine, you have so much more in a wealthy society than you do a poor society. But it's what you do with the money. It's how you distribute it out. And, human nature there is this thing called greed. It's part of human nature,
Yeah. Anyways, that's interesting. So that's why they're all shutting down, because it's like everything seems to be closed. I mean, lots of things have closed, at least here in Canada. But those centers, I can understand a little bit more what's behind that. So what's in store for you as far as seeing the future now, seeing what people need from that holistic perspective that you have?
Well, I have written a number of books, and I worked with a publisher this last year, and we put them into two series. And one is called the Soul Walking series, and the other is called the Naturopathic Health series. And they're now going to be combined and put into two online courses, which I'll be launching in the new year. And these are courses where people can actually come and, study under me for a certain amount of time. As a karma master, I will teach them karma, which is a very practical guide to help you through life, and then to go into the proactive aging and using a lot of my naturopathic background for that. And that mainly the focus there is most people don't have access to a naturopath, or even if they do, as you know, naturopaths aren't covered under insurance. So it's costly to see a naturopath, for their out. And so this way people can come and they can have that access without the tremendous cost. So that's where I'm going with my next life.
Yeah, and I can see that that's going to become more and more needed, and also more people are heading that way, just because more people are waking up that we need to look after ourselves, and
Right.
And I think the way, I mean, it's a complicated economic situation, and I am no expert on that level, but it is challenging to, if you have an education that costs you 150,000 to, donate, or make your time with people $30 an hour. You can't. Like it just doesn't work, right? So you have to charge, and then you can look at, lawyers charge, everyone who is in a profession that has paid even less than you charges. But somehow, because we're in health, it seems like, oh, that's not a model that feels right, and yet you have then the hospitals, or, it sounds like the one you're connected to is a bit different, but you have this pharmacare that is where most doctors that are in it, they have the diagnosis, all that. I'm not claiming that they don't have knowledge, of course, but solutions are very limited.
Well, it's like when I teach and work with people, pharmaceuticals are poison. There's no doubt about it. It's poison you put in your body, and, and it will not heal. It will not correct the body. The only thing that works the body, that heals the body and gives the body health, is good nutrition. And that's science. That's not something I'm making up. You need vitamins and minerals to operate the fuel of the body and make the body operate. There is not one thing in a drug that feeds the body. However, there are times when, let's say that you have a UTI and you need to have antibiotics. My problem with traditional medicine is the doctor will write the prescription and there's the prescription. But what if we had a second prescription that said, all right, you're going to stabilize with these antibiotics, and then you're going to go and get your gut back, your gut microbiota back in line, and you're going to work with someone, a nutritionist or a naturopath or someone that's going to help you correct that problem. That's the missing link, I think, in healthcare. I think
I agree. I think it's the fact that they're still in charge of chronic health really is the problem, right? Like acute stuff, I mean, not that like there's many things that work, like homeopathic medicine works beautifully for acute, all kinds of acute traumas and acute conditions, whether it's pneumonia, whatever, it doesn't matter. But it's the chronic piece where it seems like you can't start and stop with drugs. It just, it doesn't make any sense. And that's why we have the problems we do. We're continually running into the same situation.
Well, big pharma and medicine are hand in glove, and there's a lot of money, and there's a lot of regulation and there's a lot of control there. It's simple, like, here in the United States, and I think you in Canada have it.
Yeah.
For example, cannabis now. Cannabis in almost every state in the country is legal medicinally. So you can go and you can get a prescription and you can go to the pharmacy and you can choose to use cannabis instead of other things. Cannabis is an herb, and cannabis has been used since the beginning of time. Part of Mother Nature gave us this wonderful plant that has so many different things that it can do. Now, if Big Pharma could pull that in and make it into a pill and get it so that, they were in control and selling, it would be legal everywhere, right?
Of course.
Of course, because it could. And that's where we are running into this problem, because I believe that if someone wants to use herbal medicine, such as cannabis, if they want to use that instead of a drug, they should have that right. And that right, here's something to think about with that. If you go to the workplace and you're tested positive for cannabis, you can be fired, all kinds of things can happen. But if you go in and you test positive for being on painkillers, antibiotics, any of that kind of stuff, no problem, So, we've got things mixed up here.
No, we do. And it was interesting in BC, because the moment cannabis became legalized, our offices were flooded with people who wanted prescriptions. And so our board actually said that we could not prescribe it. And at first I thought, that's a very strange thing, but, and it is a strange thing, but not for the same reasons as I was trying to say. But the thing is, people will turn to cannabis with the same mindset as they turn to painkillers, right? And so even a natural thing, because many of the drugs are 80% natural, but they're patented and twisted plus, right? But without the understanding that you can't just chase things like pain with even natural painkillers, you never get to the root cause. And you never really, so I think all of those things would be much better off if they were supervised by, naturopathic doctors or people who have the capacity to understand the whole healing process,
Well, as a naturopath, our philosophy is that your body, mind, and soul, and you need to have balance in all three of those. You can't go after the body, forget about the mind and the soul. It's bringing them all together, because when you have perfect balance in your physical, mental, and soulful self, you can't help but have perfect health. That's what it's all about. So you're absolutely right. We go chasing after, getting rid of the pain of the body, but we don't come back in and say, well, where is all of this coming from? And how could we bring all three in and balance all three out? Yeah.
Because I do think pain is a big part of, the management of chronic disease.
Yep.
And therefore it does get complicated. So we're actually almost at the end of our time. That was
fun. We could talk forever.
What else can we bring up here? Well, actually, anything else you want to share, like just as closing, or any other?
Just, I think what I just said, your listeners, that's really the thing to focus on, is that, seek out people who have the education, who have the background, who can help you work all three of those areas, because that's what's really important. Mother Nature gave us everything we need. Everything is in Mother Nature, and it all comes back, and it begins with basic nutrition and exercise and sleep. Those are the three pillars of health. Pay attention to those three things, and pay attention to bring your body, your mind, and your soul into balance. And that's really the key to health.
Yeah. I would agree.
Yeah.
Sorely missing in the last couple of years.
Absolutely. Yes, it is. Yes. During the pandemic, it was like, it's funny because when teaching, I have several people that I've talked to, and they've got they call it the COVID 15, the 15 pounds that they put on.
Oh,
and so
okay.
and it's what happened. We went into this and people were just like, well, I'll eat whatever I want and I'll drink as much as I want. And, and now the reality of that is coming in, and it's like, oh, wow, I really didn't take care of my health during a time when I should have been taking care of my health, because your immune system is number one.
Yeah, oh, absolutely. And as I think I was telling you earlier, in Canada here, I'm not allowed to talk about the immune system and how how we count on it and how it's always worked, because we had to listen to the predominant narrative by so-called unappointed health experts. so we were listening to that, and so much got lost in that time. I was thinking secretly in my heart that this is the time, after being in practice 30 years, that the naturopathic board, the association, that all of us would join hands, go forward and say, this is a dream, right? But hey, we can totally look after ourselves. We don't know what it is, but we have a body, we have experience. There's been other, issues in the past. I just thought this is where we could shine, because it didn't look like they knew what they were doing. Now, hindsight, I get it that they knew what they were doing, and working with this much fear, and then coming up with, again, a godly, wonderful thing like biotherapy, right? Which most people wouldn't have wanted to try. And a lot of people, at least in Canada, still don't know that we're in the third phase of the trials. They still don't know that they are a guinea pig.
Yeah, no, they don't. People do not understand what this was all about. And the thing that I continued to teach to my students, fortunately, I had a Zoom, and all my students would come, and I would say to them, no matter what, pay attention to the basics. Eat a healthy diet, exercise every day, get some sleep, take care of your body naturally, because nobody knows what's going to happen. And you're going to be in a better position if you get COVID or anything, if you're coming from a health place. Yeah. Right? If you're pretty healthy, you're gonna go through it a lot easier than the person who was really, so to speak, trashed their body, and they're compromised, and now they've got to fight this off. No, it's better. Keep that immune system strong.
Yeah. Okay, we're going to end on that note, and thanks very much, Lynn.
Thank you very much. It was a pleasure speaking with you.
Thank you for joining us at the Healers Café with Manon Bolliger. Continue your healing journey by visiting thehealerscafe.com and her website, and discover how to listen to your body and reboot for optimal health.